Hello everyone, my name is Dr. Chaitra.shivananjaiah, obstetrician and gynecologist from Ofam Banshankari. Today we will be discussing about one of the most irritable symptoms that a woman faces in her first trimester of pregnancy, vomiting. Well, why does this vomiting happen? Why do most of them have this vomiting? Well, the change in the hormonal status in pregnancy, more so and particularly a hormone called the hCG, is the one which can cause the sensation and vomiting, excessive vomiting. Also, other contributory factors will be an elevated amount of estrogen, the immunomodulation which is happening in the body. So, simple amount of nausea and vomiting is expected in every pregnancy. A little bit of vomiting which is not disturbing their routine activity, simple morning sickness. We call it morning sickness. But when this vomiting becomes excess and making our day-to-day activity a little difficult, then we call it hyperemesis. Well, why does this happen is what I've already told you. Now, simple vomiting is happening again because of the elevated hormones. So all that we need to do will be to reassure them. We need to guide them, explain the condition to them, and give a little bit of substitute of vitamin B12. And some of them may require a low dose of antiemetics also. A diet becomes very vital here. We do explain to them that please do avoid oily food. Have small food but at regular intervals. Also, anything which is going to stimulate cough or a lot of spicy food also has to be avoided. Dry carbohydrates can be consumed like bread or biscuits. So these are the few tips, the diet tips that we do provide them. But when it comes to hyperemesis, that is a condition wherein there will be excessive of vomiting that can lead to certain complications in the mother. Well, who are the women who usually have this pregnancy, the first pregnancy, a woman who is becoming pregnant for the first time, usually in the first trimester, which usually resolves by around 14 weeks. And also when she is having twin gestation, because the hCG hormone also will be higher, so that is why she may have excessive amount of vomiting. So these are the few women who are predisposed to developing hyperemesis. Now, this particular excessive vomiting can lead to dehydration in the women, can lead to electrolyte imbalance and also metabolic acidosis. These conditions will definitely require immediate attention, as we do have to correct the dehydration status in her. So when you have to correct the dehydration, we evaluate her for the status of her electrolytes in her body also. So we have to correct the electrolytes, give her enough amount of hydration, and then we put her on antiemetics. Slowly we wean off the antiemetics when she starts getting used to it or the body adopts to it. Hyperemesis on the child doesn't have a very deep impact, but yes, over a period of time we have seen, and multiple studies have proven, that the child can be low birth weight baby, and some of them can also have premature, that is delivering before 9 months of pregnancy as well. So please do talk to your doctor about these conditions, as it is easily treatable. Thank you.